It has been dubbed by the government as the world's largest public health insurance scheme. The National Health Protection Scheme was launched in the last union budget with the aim to cover 10 crore poor families. Each family will get a health insurance cover of 5 lakh rupees per year. The Niti Aayog was tasked with finalizing the modalities. After a meeting with state governments at the Governing Council over the weekend, the Niti Aayog has said that 20 states and union territories have signed up for the scheme, but some states like Punjab, West Bengal, Kerala, Odisha and Delhi have their reservations. In fact, the Health Minister of Odisha has said that their state scheme is much better. Union Oil Minister Dharmendra Pradhan hit back, calling it an attempt to hijack the central scheme. Today, we're joined by Indu Bhushan, the CEO of the National Health Protection Scheme, and the former Union Health Secretary K. Sujatha Rao. Appreciate you joining us here on the program. Mr. Indu Bhushan, if I may start by asking you to give us an update first on how many states are actually ready to sign the MOU with the centre. There is a 60-40 ratio that the centre had envisaged. Can you give me an update on the states that are ready to sign that MOU?
Actually, 22 states and UTs have already signed the MOU, and we have about 8 more states and UTs which are ready to sign. So by the end of this month, we should have about 30 states signed up.
What about states like West Bengal, Odisha, Delhi, Kerala, because they had publicly expressed reservations? Punjab, the non-BJP states, have they come on board for this as well?
Yes, actually, many of them are coming on board. On 21st of this month, I'm going to Andhra Pradesh. We are signing MOU there on 21st. And then West Bengal also has indicated that they've approved the scheme in principle, and we are talking to their health department, and we hope to sign MOU with West Bengal very soon. And Kerala, we've been in discussion with Kerala. Karnataka, we are having a discussion tomorrow. So many of the non-BJP states are also on board. We are also still in discussion with Odisha, and hopefully we'll reach some agreement with them. With Delhi, unfortunately, we've not been able to have any feedback, and we hope to have that soon too.
You said that you hope that there will be a breakthrough in your dialogue with
some concerns.
Okay, so West Bengal has concerns, Odisha has
Punjab,
concerns,
yes.
Kerala has concerns, Punjab, Odisha. You know, where do the concerns really lie? What is the problem that these states are expressing? If you can give us some color on that.
Mostly the issue is that they have their own schemes which cover more people than what we are proposing. Although the coverage is not as large, and they don't have national portability and some other features that we have, but they have their own scheme. So it's a question of convergence, how we can converge their schemes with the National Health Protection Mission. And so there are no fundamental issues. It is basically how we can converge both these schemes. And we are finding ways, actually. I'm very hopeful, like I mentioned, that we have had a breakthrough with the West Bengal. We have a very constructive discussion with Kerala and Karnataka as well. And we had a good discussion with Punjab, and there are a couple of issues that we need to sort out. I think Punjab should also be on board soon, hopefully.
Okay. So what are you willing to put on the table to ensure that these states do in fact participate? And how do you plan to address the specific concerns that they've raised on the issue of coverage specifically?
Basically, we are putting on table a national program because it's a program which is going to cover the entire population, entire country. And unless all of them participate, we can't have a truly universal health coverage, although still we're covering 40%. So we want all the states to be part of this ambitious scheme. And of course, we are providing resources. We are also providing expertise and advice. And if also we are providing the integration through national portability. So anyone from any part of the country can avail of services anywhere in the country. So that's also a unique feature of this mission. So we want all the states to be part of this national mission.
Before I get Ms. Sujatha Rao into the conversation, let me ask you about some specific concerns that have been raised, not just by states, but by the providers of healthcare services, the hospitals themselves. Now, there are several reports that suggest that the Hospitals Association has in fact written to the Niti Aayog, has written to the Ayushman Bharat scheme, raising concerns about the pricing. They believe that the rates that have been arrived at are too low, that they're barely about 11 to 15% of the costs, and that they are asking the government that the rates be reasonably and scientifically arrived at. Has there been any consultation now with this healthcare service providers on the issue of rates to ensure their participation?
Is that question to me or Ms. Rao?
Yes, no, to you, sir, to you.
Oh, actually, see, given the diversity in our country, it's very difficult to arrive at one rate which is applicable to all states and within each state to all parts of the state. Of course, the cost structures are very different in different states, and within states they're different between urban areas and rural areas. Therefore, we've done a very rigorous study of the existing rates, because we are starting taking RSBY and the existing schemes like CGHS as a base. And there was a work done over one year where these packages and the rates were derived. And then Niti Aayog actually had done the peer review, and they conducted several meetings in about 60 different places in the country, and they have further revised it. So now these are the rates which are indicative at the national level, but the states have flexibility to change them. They can increase those rates within a band, they can also decrease them. And also, if their existing rates are same, much larger, they can match these rates. So we don't see that there is a lot of flexibility here. And as we see it, that on these rates, already there are several hospitals which have come forward and they want to be impaneled. So we, and of course, we're also in a learning phase. This is the scheme which is very big, covers 50
how many
people,
hospitals?
And we'll be learning from the experience.
How many hospitals have been impaneled, sir? Sure. How many hospitals have been impaneled? And I go back again to the letter that reportedly has been written by the Association of Healthcare Providers, and they say that there was no basis for the rates that have been fixed by the government. You're saying that there is enough flexibility for rates to be moved within a band upwards or downwards depending on each state. But the Association of Healthcare Providers say that only very low-cost hospitals will find favor with the scheme, and at least specialized hospitals will not be able to provide these services at these rates.
First, there has been a very strong basis for setting those rates. And of course, in our country, there has not been any rigorous costing study, but we have taken the previous rates under previous schemes as the base, and we've worked on those. In addition to that, as you mentioned, we have provided flexibility to states to change those rates. So we hope that with that, I think some of the concerns of the health professionals and healthcare providers will be met. And also we'll be undertaking more rigorous cost study in the coming year, and hopefully we will change them and learn from our experience in the first year and improve on these rates.
Okay, let me bring in Sujatha Rao, the former Union Health Secretary. Ms. Rao, you know, what we've just heard from the CEO of Ayushman Bharat scheme is that 22 states have signed an MOU with the government. They're hopeful of being able to address the reservations that states like Kerala, Orissa, West Bengal, Punjab, etc. have raised and get them on board also. And also giving an assurance that even when it comes to rates, the apprehensions that are being expressed by healthcare providers will be addressed as and when the scheme rolls itself out. In balance, do you believe that we are now set for this scheme to see the light of the day?
Shereen, that's a pretty tough question you're asking me, given the time limitation. But let me quickly go through those 2 points. Yes, there are some more states. In fact, Andhra, Telangana, Tamil Nadu, you've forgotten, Kerala, Karnataka, they all have to sign. I think they're in the process. I won't be surprised, and I don't see why they should not sign up the MOU, because the government of India has given them a lot of flexibility to stick to their own rates and not really change too much of what is going on, and also some amount of, you know, the freedom to do the way they were doing. So I don't see, I think, you know, it's just a question of coverage. The SCCCs that is the basic population line to be covered by methodology that government of India has been taken is not really fitting in with the states who cover more. So they are wondering about the financial implications and so on. And from the state's point of view, getting 60% of that money means it frees up some more money for doing other things. So it's a good scheme, and the government of India also can piggyback on the ongoing programs and show a much better progress very quickly. The important thing is about the rates. The ones, I mean, I couldn't hear very clearly because of the audio, what Indu has mentioned, but I'm not so sure whether really these rates will stand good scrutiny. I went through them. I find them a little low. It's admitted that they're 30% lower than CGHS. Now, if you take Karnataka, for example, they did an internal exercise, the health insurance, the government-sponsored health insurance program there, and they found they were paying 30% lesser under their programs to the private providers. So, you know, they are themselves on par or a little more than CGHS, and they're finding they're 30% lesser than so, you know, what happens really is that unless and secondly, you can't have one uniform rate. The input prices of a district hospital, a community health center, and a tertiary hospital are varied. The same appendectomy done in a secondary hospital will cost much lesser than if it was done in Apollo in Hyderabad. So there has to be these variances that have to be brought in, and so a lot more of work has to be done on these rates, and I'm absolutely sure they'll have to go through a revision. And as for the healthcare providers, you know, the flexibility that they've given is, if you're NABH accredited, you get 10% more. If you are, you know, something, so they've given certain flexibilities up to 30%. But according to them, they feel that the rates are the base is so low that even if you gave that flexibility of 30 to 40%, it still won't match up to the cost. Now the problem, there are just 2 more points, Shereen, and I will then close down. One is that the poorer the states and the more backward the states, the more difficult and more expensive it is for them to be able to. The volume and the scale advantages are only in the south and in the metro cities. So, you know, if you go to some Jammu or some 2-tier in UP or something, no human resources are willing to go there. So that is the problem that, that is going to be faced, and they cost much more. So the cost of delivery of the same service in the Tier 2 and Tier 3 cities, particularly in the northern states, is going to be much more. And so this is going to be one big problem of the rates again. So the portability has been taken, I believe, as one way of coming across, you know, crossing the bridge right now in the short term, which will mean that a lot of patients from the north are likely to be, and I know for a fact that a lot of insurance companies setting up diagnostic centers in the north are promising AC 2-tier and a companion thing to come to the south and get their surgeries done and so on. So now this kind of arrangements are okay, but then there is a whole post-hospitalization care that's required. What's going to be happening to the quality? What's going to happen to the indirect expenditures? So these are issues that they need to think through. And the southern hospital, it's not as if they're you know, unending flexible, that they can take in the different varieties of patients. So I think there's a lot more thinking, a lot more, but it's the first step, and I'm not surprised. I'm sure they'll sort out all these issues in days to come.
Yeah, valid points being made there by Sujatha Rao.
Shireen,
Mr. Bhushan, let me get you to respond to those. And go ahead, sir.
Sorry?
Yeah, Shireen, what Sujatha mentions is correct, that we can't have one rate for the whole country, and that's why we have this flexibility across states. So one thing that we have told states is that if their current rates are much higher, they can actually keep them. And so all the southern states, if their rates are, say, 20–30% higher than what we have proposed, they can keep them. Now, in these rates, what we've done is we've tried to incentivize quality and equity. So if they are certified by NABH, they can actually increase their rates by 15%. And if they are teaching hospitals, they can have further 10%. So the rates can go up to about 25%. If these hospitals are located in poor areas, what we call aspirational districts, we give them 10% more. So we are providing incentive for these hospitals to go to poor districts. So that will actually ensure that we have different rates in different parts of the country, but also we incentivize quality and opening of new hospitals in poor areas. Yeah.
Okay, so you said that you are building in the flexibility that is required on account of the apprehension that Sujatha Rao raised and hospitals have raised as well. How many insurance companies are on board? How many hospitals are now on board, Mr. Bhushan?
Actually, one problem that we see is that there is no one representative body for hospitals. We have FICCI, CII and others which represent hospitals, but they don't cater to, say, tier 2, tier 3 level hospitals. Because every day I meet some group of hospitals which come from outside Delhi, and they seem to be okay with these rates. And actually many of these hospitals and especially many medical colleges, private medical colleges, they actually provide the services free, and they are looking forward to joining this scheme because they will be able to get compensated. And actually we've done the analysis. So of course I can't say that our rates will cover average cost of all the hospitals, but I'm quite confident that the rates that we have cover the marginal cost of hospitals. And one thing that you need to be also note is that we are providing huge volume. This is for 50 crore people, and so once this kind of volume and this kind of business is provided, I think the rates should come down. And as you can understand, that we have been established, this National Health Agency has been established to be a purchaser of services, and we have to establish these rates. And so we are in the process of establishing these rates, and we have to start with a point where we can defend those rates. And also as you will appreciate, that these rates that we establish right now will become the water point, and in future when we have to change these rates, of course it will be very difficult for us to decrease rates at that time. So we are also being conservative in the sense that we are looking at the sustainability of this scheme so that we keep the rates manageable and not increase the healthcare costs, but also keep into account that maybe because of the large volume, the rates will come down.
Okay, you're saying, you're admitting that this is at marginal cost, but you're also hoping that volumes will in fact make up for it. Before I go back to Sujatha Rao, I want to quote to you what the Director General of the Association of Hospital Providers is saying. Now, it comes back again to the issue of rates, and Mr. Girdhar Gyani in his letter says that participation of healthcare providers would be sparse, and Ayushman Bharat will remain grossly ineffective on the ground if the government were not to review the issue of rates. So how do you respond to that then, Mr. Bhushan? Because if you're going to have trouble decreasing the rates, you will also have trouble increasing the rates once the scheme rolls out.
Well, I respect Dr. Gyani a lot, but in this case I respectfully differ, And I believe that with these rates, thousands of hospitals will be willing to work with us. And these rates are not low. They cover the marginal cost. They will encourage quality providers in tier 2, tier 3 cities, but also in tier 1 cities and cities like Delhi and Mumbai.
Okay. Okay. Sujatha, you wanted to make a point and also respond to what we just had there from Mr. Bhushan. And this is the argument that the government has been making, that the volumes will offset the issue of cost.
You know, Shereen, if you you know, in the south, I think it's already a saturated market, if I may put it that way, in the sense that, you know, the hospitals that are already catering to the existing government-sponsored health insurance schemes, you know, you have to understand one point, that every government-sponsored insurance scheme, in the market mix that they have, we are not a single-payer country. So in the market mix, they can afford to have 20% of the patients under this government-sponsored marginal cost recovery program. And they'll have to have rich patients, and they have to have foreign patients to make do their profitability or their average cost or whatever, you know. So the point is, the flexibility to take on more patients is a concern which needs to be looked at. That is one thing. So if there's more volume, yes, certainly some pricing may come down. But what is of concern to me is today in tertiary care, unless government invests heavily, the tertiary market, 80% is in these corporate or these high-end hospitals. So if you exclude them, and for them they're likely to find the rates way too low, and if you don't have a practical and a feasible discussion around them, you may be ending up with only providing like a upgraded RSPY, providing some kind of secondary care. These thousands of hospitals that Indu is mentioning, who are these thousands? What is the capacity? They'll be able, these thousands are providing you secondary care. How many of them have, after all, we have a shortage of surgeons, we have a shortage of oncologists. So where are these people for tertiary care going to be coming? And they're all being bought up by anything by these big hospitals, because there is a scarcity of human resources. So, you know, in the health sector, you enter into one problem, you trigger several other sub-problems, and the whole thing has to fit in. So it's a very daunting task. I don't envy Indu at all. But I'm sure that with time, they'll tease out all these problems. And, you know, you have to make a beginning, and I think they've done well in starting somewhere. And let's see how it goes.
Absolutely. So, Mr. Bhushan, let me then try and get some wrap-up comments from you. You know, realistically, what are we looking at in terms of rollout? What is the update in terms of the IT infrastructure? And finally, Mr. Bhushan, what is the cost that we're talking about?
Well, we are working on the IT infrastructure, and that is indeed the backbone of the whole scheme. And we have chosen Telangana's IT model for replication across the country, and we are working on customizing it right now. And so the first module of that IT infrastructure was for empanelment of hospitals, and that was soft launched 2 days ago, and we'll be putting it out for empanelment of hospitals in 2 weeks' time. And then we are going to work on other modules for identification of beneficiaries and claim management, and that will be done in July. And so hopefully our IT backbone will be ready by end of July. And after that, depending on the readiness of states, we should be ready to roll. But the exact date will be decided by the Prime Minister.
And the costs, sir?
Hello?
The cost? Can you say that again? I didn't hear. Yes.
Yes. How much is this going to cost the government? Because only 10,000 crores was provided for in the budget.
Well,
oh, actually, no, 2,000 crores was provided in the budget.
The cost will be discovered through the bidding process. Actually, 2,000 crore is not correct, because if you look at the budget document, it's much more. And you have to see 60% is from the state, central government and 40% is from the state government. So I think you calculate all that. But all those figures are indicative, indicative only, and the actual cost will come out after the bidding process is over. And so since we are doing this for the first time, and in many cases the states don't have the experience, so I'll not hazard a guess, but we are ready for whatever comes out of the price discovery process.
But surely there has to be some number that you're working with. So I mean, the budget is. The budget has got to factor this in. You know, the finance ministry is going to have to factor this in. You've already got the finance ministry having to deal with higher crude prices and the possibility of higher MSP outflow as well. So what is the broad calculation that you're working with?
You know, Shereen, the budget actually has not been the problem with the health sector. Of course, budget levels are low. But more than budget numbers, it's the absorptive capacity and ability to use the budget. So, so I'm not really concerned about the budget, and if we need money, we'll get that money. It's a flagship program of the government, and we don't foresee any problem with finding resources. I think first we need to put all the elements of the scheme in place, and then we worry about the budget.
Shereen, he's
all right, I'll give Sujatha Rao final say, ma'am. Yes.
Yeah. No, I'm just saying he's not hazarding a guess, but I don't think it will be very much of a financial stress, because already now we are in June. By the time they finalize everything, it will go on up till November or December. And secondly, as you know, in the northern states, the premium is going to be very low. As you know very well, that the more the utilization, higher the premium. So that's why Telangana and Andhra started with something like 300 or 400, now they're 900 rupees. So the premium is going to increase with time, and so they're going to get very low rates in these northern states, and the southern states are already frozen, so there's not going to be much of a change. So I think it's pretty easy for them to calculate how much. I would hazard a guess of 4,000 crores is the maximum they'll be able to spend this year. And that should be available.
4,000 crores maximum of, yeah, I would imagine that would be readily available. This year, yeah, this year, for whatever is remaining of when the scheme rolls out for this year.
There's also 40% coming from the states too. So, you know, it won't be more than that, and I'll be surprised if it crosses that. So,
Mr. Bhushan, final say to you. Would you go with that number? Didn't want to hazard a guess. Sujatha Rao's put a number on the table.
He's being very cautious. He's being very cautious. Well, so I'm given a figure. Come on, Indu, be brave.
Again, you know,
be brave, Indu.
This is the scheme. Well, Sujatha, no, I'm being honest.
Be so diplomatic.
This is a scheme being done for the first time, and well, I'm not being diplomatic. I'm being honest that we really don't know. We are in a really unknown territory right now. But the one thing that you mentioned, Sujatha, is right, that half the year is gone, and so it will be only for half the year.
It will only be for half the year. Well, Indu Bhushan, the CEO of, and your guess is 4,000 crores at the most, Sujatha Rao. Sujatha Rao and Indu Bhushan, appreciate you joining us here. Plus what, what the states contribute.
Okay. Yeah, means 40% of
appreciate you joining us here.
The maximum, not more than that.
That's right. That's right. That's right.
Okay.
Thank you for joining us to decode Modi Care and the way that it's likely to work. Appreciate your time here on CNBC TV 18. That's a wrap on this CNBC TV 18 special. Don't go anywhere. A lot more continues.